911 emergency.
Send an ambulance, I need help right now. Something terrible's happened to my husband. I think he's having a stroke.
The paramedics came. They asked me a bunch of questions, which I could barely hear them. There was so much screaming going on in my head, I couldn't hear them. They said, "Come on, stand up." I said, "I cannot."
You tried.
I tried, and then I fell down again. That's all I remember for about, I don't know, 5-6 weeks, I think.
Mr. Sundin's situation was critical. He had a stroke in evolution, which meant that he had a blockage of a hindbrain artery with no flow to the cardiorespiratory centers of his brain. Left untreated, this was a 99% fatal condition. We took some pictures of the hindbrain artery showing a complete blockage of flow. No flow to the upper part of the hindbrain arteries. We were able to take a microcatheter, it's about the size of a hair, steer it under X-ray guidance up into the brain to the area of the blockage. We're pulsing in powerful clot-dissolving medicines right at the blockage. Within a few minutes, we're able to open up the artery, restore flow. Here we have restored flow to the hindbrain arteries. We're starting to get more blood flow and oxygen to the cardiorespiratory centers and reverse the signs and symptoms of the stroke.
A stroke never would have entered my mind. Never. You just do your best to get them through until those paramedics get there. What did I think? Oh God, please let him live. This is when it gets tough. I leaned over and I said, "Bye, honey, be a good boy, I love you." The last words I hear as I'm walking out the door are, "I'm sorry, T."
Every minute after stroke symptoms start, thousands of brain cells are dying. This means that time is brain, and rapid diagnosis is essential. The newest imaging tools provide the most precise and accurate and rapid diagnosis for stroke.
When you have an aneurysm, at least as a nurse I knew that at any point it could burst.
Brain aneurysms are another critical cerebrovascular problem that we deal with. Brain aneurysms are a weakening of the wall of the artery. The balloon-like or sac-like dilation is very fragile and prone to rupture. In fact, 50% of the patients who have a ruptured aneurysm will die. Here's such an aneurysm in a 47-year-old patient. This balloon-like or sac-like dilation is coming off the artery here. We're able to thread our microcatheter up toward the aneurysm in this picture, and finally we fill the aneurysm with these coils, sealing it off from the circulation and preventing it from ever rupturing. And this is a revolutionary, very successful technology that's available here at Scripps.
It's like having a water balloon, and you never know when it's going to burst. And when it bursts, you have a 50-50 chance of making it, and if you do make it, then a lot of times people are left with a tremendous amount of residual disability, which is why it's so important to get it treated right away.
The first thing we have to do when a patient gets in the room is do a diagnostic angiogram. We have to look at the arteries in their brain. At times it gets a little stressful waiting for all these pictures to come out and knowing that the clock is just ticking away on these patients.
The radiology department at Scripps Memorial Hospital in La Jolla currently has a single angiography suite. A second will accommodate backlogged volumes and enable the development of a comprehensive neurovascular center for the diagnosis and treatment of cerebrovascular disease, such as stroke and aneurysms. No other hospital in San Diego is poised to offer a comprehensive program of this magnitude and position Scripps to become the stroke intervention and neurovascular center in San Diego.
Part of a comprehensive neurosciences center involves not only the best equipment for treatment of the problem, but also the best diagnostic equipment. We feel that a comprehensive neurosciences center needs to have the most advanced CT scanner, the most advanced MRI scanner, and the most advanced biplane neuroangio room for treatment. This will enable us to do a number of things. rapidly diagnose very serious conditions and rapidly treat them using these very powerful endovascular techniques.
Here at Scripps Memorial, we have a nice blend of the most advanced technology that has come out within the last couple of years, and we have some equipment that, while still providing a high level of care, could be upgraded to provide and take advantage of the latest advances in MRI and CT.
I think about communities that have these small country hospitals that don't have the doctors, that don't have the facilities, that don't have the health insurance, that don't have the scripts, that don't have those places. And I think, what do? They don't live. They don't make it.
Over the years, Scripps and the San Diego community it serves has benefited from the commitment and generosity of many extraordinary individuals. With the current need to create the Neurovascular Center, that tradition continues.
I'm Harry Collins. I'm a longtime friend of Scripps Hospitals, and I'm pleased to tell you that I was recently in the hospital and met Dr. Todd Lempert, the radiology department, who fascinated me with his explanation of the new world-class treatment that is available for stroke. When I heard what could be made available, I wanted to get involved in helping make this a reality at the earliest possible time.
I'm Kerry Caldwell, President of the Scripps Foundation for Medicine Science, and I'm here today to talk to you a little bit about a new campaign, a new initiative that we're launching that has the potential to change the way healthcare is delivered in San Diego County. The future of healthcare is going to be centered around disease prevention, and if not prevention, early detection. Expanding our capacities in imaging, in radiology, in the neurosciences. This is going to enhance our ability to detect disease early, to perhaps prevent disease. When a patient comes into our hospital, we will have the most sophisticated imaging technology available. I don't know of any other way where a person can make a direct investment in something that's going to change not only the quality of life, but in some cases save the life of an individual. Do you want to help shape the future of healthcare in our community? You can see how people's lives will be changed, lives will be saved because of this effort. I think that's the question that you need to ask yourself. Do I want to make a difference today?
During every minute that you're watching this video, another American will suffer a stroke. A third of those patients will die. 160,000 Americans will have a stroke this year. That's why it's critically important that patients get rapid diagnosis and rapid treatment. This is why it's essential that we mobilize our forces and assemble resources to develop the neurosciences and neurovascular programs at Scripps so that we can have the state-of-the-art, most timely and efficient diagnosis and treatment for stroke in the United States.
It's like I look the same, I sound the same. My post-operative recovery was insignificant. And it was only 9 days ago when I had brain surgery. And that's really incredible, really incredible. You know, I brought them candy and cards. I don't think you can thank. I don't think you can thank them enough. You know, and I don't think that they were just doing their job either. You know, I think that they were all very special, and I mean, I don't know how you can thank them other than to go on with your life and enjoy it.
Scripps Memorial Hospital in La Jolla is a great hospital with great